Develop and Plan Part 1, Day 2 of a 4-part series. My name is Heather Bradley. I'll be your webinar administrator today. I'd like to point out a few housekeeping details. We will not be doing hand raising during this session. However, there will be a question and answer period. You can submit questions via the question or chat feature on your control panel, which is on the right side of your screen. Also in the handout section is a copy of the PowerPoint slides, as well as 2 additional reference documents, which you're able to download and save copies of. With that, I'd like to turn over the webinar to Caitlin Huntington.
Hello, everyone. Thank you for coming back for our second day of telemedicine program planning. Really briefly, the handouts that are available, one is a spillover from a question from last week, and it contains the telemedicine codes for Medicare, as well as their definitions of where services are eligible for your reference. The other handout are the 3 sheets we're going to be going over today: the worksheet, the logic model, and a business plan. So to get started, today we are going to be focusing and building off of your needs assessment and readiness assessment we did last week, and we're going to be developing a program outline. And we're going to be doing that, and there's various ways to do that: a worksheet, a logic model, or business plan. They range in varying degrees of complexity and how much work you have to put towards them, but we're going to start with the easiest, which is the worksheet. So why do you need this framework? Why do an outline? So exactly that. You need the outline as you progress towards implementation. It allows you to go back and check to make sure you're on track and make adjustments as necessary. So last week I was talking about the 1, 10, 100, 1,000 cost. By having this outline, that allows you to go through that process to make sure you stay in the lower cost, so to speak, area. And this also is that next step to build upon the needs assessment that you did. So why not jump straight to technology? Everybody loves the technology. It's the most exciting part, getting to play with everything that's new out there. So it's not uncommon to want to jump into immediately what technology you want. And you do need to do that at some point, just not right now. It's asking the right question, but in the wrong order. You really need to develop your plan first to make sure you're going to be looking at appropriate technology. Technology does get expensive. Granted, it's cheaper than it was 10 years ago, but you don't want to end up and spend that $10,000 or more on equipment that's not going to necessarily meet your needs, or you're not going to be able to grow from, and now you have to spend even more money down the road as you expand your program. So what are the difference between the 3 plans we're looking at? So your worksheet is going to be your simplest. It's a quick way to organize your problem and need. It's an easy reference for general goals and outcomes of your program. It's just a quick thing you can go through and double check yourself and make sure you're following your proper path. Your logic model is a little bit more involved, and it really focuses on making sure you've developed a way to evaluate the effectiveness of your program. You can think of it more as a sequence of action. And then the business plan, is more of a formal statement of your goals, the reasons why they're attainable, and how you're going to reach them, and it tends to be the most detailed out of the 3. So we are going to focus on the worksheet right now. And so it covers 6 categories: your problem or issue, need, desired outcome, barriers, assumptions, activities, and strategies. So if you've downloaded the handouts, when you're looking at the project worksheet, I created a couple of examples of how it needs to be written out. So you're going to start with your problem or issue, which should be a piece of cake. This should be something you've done for your needs assessment. And your next step for your need, that should be built off of your needs assessment as well. And it's just stating why you need the program for your area. Your desired outcome, effect, or output is what you want to get out of this telemedicine program. And then there's a couple questions to answer to kind of make sure you're in line with what you're doing. So this next section goes over your organization, your community, your key stakeholders, and the unit responsible. This should be really easy to fill in if you've done your needs assessment and your readiness assessment. It's taking pieces of those and building on them so you have a more defined direction that you're going in. The last couple sections, the big one is a target population. It's always good. It should come out of your needs assessment as well, and it's just reiterating who you want to go after and how this program is going to benefit them. Another good thing to look at is the next section of other programs, and this way you can compare what's already happening and where maybe this telemedicine program can supplement something that's going on and making sure you're not duplicating efforts. The last one is really key, the assumptions that your program makes. This is where you're going to make sure that you're kind of doing your what-if statements for down the road in case there's any bumps. So it's just going through, if you're trying to implement a program, what assumption are you making that this program is going to be successful? Are you going to assume that all of your providers are automatically on board with this? If you have that down in writing, you can now look at the what-if of, well, maybe if all of them are not on board, this is what we're going to do. And I do know last week a question was brought up on how to address provider hesitancy towards implementing telemedicine programs. I am working on gathering some more information. What I have so far is it seems to be everybody kind of goes in general directions. I have heard from various people where they sit down and they do education sessions and let them play with the technology and get comfortable with it if they're at that section. And then I've had others say, well, I just put my foot down and tell them we're doing telemedicine no matter what, and they either need to get on board or they're going to lose patients. So I'm not really sure if that ultimatum last one is the best way to go, but that's what I've been hearing. I'm working on kind of developing something a little bit more to hand out that will go into more detail of how to address hesitancy that people come across. The last part of this worksheet is just addressing your steps, and it describes your activities and strategies that are needed to implement the program. So what kind of training you're going to be needing, what kind of marketing, what's your referral system going to be looking like, your program stage. It just looks at how you're going to be developing it, and you're going to compare it for later for evaluation aspects. So the next option that you can have is your logic model. And I have to say, coming from a public health background, I really like logic models. They're one of my favorite, and mainly because it has a nice sequence of action to it, but it really forces you to focus on the evaluation aspect of your program, and that is key in making sure you have a successful program. So the logic model is broken into three sections. You have your inputs, your activities, which are your objectives, and your outcomes, which are the impact of the program. So now we'll discuss each section of that. So your inputs, the section of that is your inputs are what you're going to invest. It's the ingredients needed to conduct the activities and accomplish the outcomes. So it's going to list everything that you have to support your program. Staff, time, money, equipment, technology, anything like that you're going to put into the input section. So your activity section, that's going to be what you do and who you reach. So you're going to be looking at the how. How are you going to get to that? Through your training, your marketing, your encounters, you're going to look at your providers and your patients. And this is where you're going to start formulating towards that evaluation side of looking at the data of everything that you need. So activities, when you're looking at objectives, this can get, this is a little bit more detailed if you want to go into it, but there's two types of objectives. You have a process versus an outcome objective. Your process objectives are going to describe your activity, whereas your outcome objectives describe the intended effect of the program. So for example, your activity is going to be a little bit more broad. Maybe it's providing telepsychiatry to this remote clinic. Whereas your objective, you're going to get more detailed and assign a way to evaluate that too. So your objective is maybe this many patients by this time will have access to service without undue traveling. And the key to having that objective, and it goes into the outcomes as well, is remembering SMART from last week. You're specific, you're measurable, achievable, realistic, and timely. You really need to remember that when you're developing in the logic model, because those are going to help you develop how you're going to determine if your program was successful. So the last part of it is your outcomes, and those are typically divided into three types: your short-term, your intermediate, and your long-term outcomes. To be honest, I tend to just focus on short-term and long-term. Short-term is usually within your first 6 months to a year of your program. Your long-term, you're typically looking at 3+ years after you've had your program. And that is going to be looking at how you're going to show that your program's been successful. So on to the business plan. So your business plan is the last one that you can choose from, and it tends to be the most involved and the most in-depth. It has a more formal appear to it. And as you can see, it's divided in quite a few different sections. You've got executive summary, your introduction, you've got a needs assessment, a service plan, you've got another internal assessment. You're also putting down a marketing and a technical plan, your regulatory environment, your management, and your financial section. So in the handout, the business plan template summary that I have was developed by the American Telehealth Association, the ATA, and it is specifically designed for a telemedicine program. So now we're going to look at each section of the business plan just to kind of go over an idea of what each one is going to entail. So your executive summary, as you know, your executive summary is going to be the summary of your overall plan. Your introduction and background is going to be what you do, and your needs assessment you should have already done. So those introduction and background and needs assessment should have already been completed in your first step. So it's going to be really easy to fall into it. So your service plan is how your services are going to be delivered, how they'll be reimbursed, any tech requirements you have, and this is where you're going to identify your champions, which, having done the needs assessment and the readiness assessment, you should already have a general idea of who your champions are going to be in your organization. Champions are really key with having a successful telemedicine program, and it's good to make sure you have a champion in various sections of your organization. So make sure you have somebody in the administration side that you have a champion for, and the clinical side. You want to make sure that you have support in all of your sections. That way, as staff turnover goes through or you hit a bump in the road, you've got that support to help keep that program running. The next step, your readiness assessment, should have already been completed with your needs assessment. It's looking over your strengths, your opportunities, your weaknesses, and your threats. So the good thing about doing that first step we talked about last week is you're actually starting to develop certain sections of this outline. So it's really just putting the other pieces together. So it's not quite as much work as it looks when you're looking at about the 12 steps for this one. So your marketing plan, this is really key. It's going to be how you're going to communicate and engage patients and providers. And you need to make sure you are engaging both sides of it. You want to look at what your patient's needs are, what other locations near you are providing telemedicine. You can look at the cost. And the key way is to look at ways you've previously engaged your patients. So this is something new. Granted, it has been around for a while, but it's just kind of kicking off. It's new with this area. You're trying something new. You want to look at how you have engaged your patients before when you're introducing something new into their care, and follow that along the similar lines and make sure they understand what telemedicine is, how it's going to work, how it's going to be a benefit to them. So maybe they don't have to travel as far for it. That's the big one. Now they're able to see a provider closer to home. So you really want to make sure that they understand everything that's going on. And the other big one is doing marketing with providers, because they are key too to this. You want to make sure they understand the benefits of telemedicine and bring them on board with this. So your technical plan, really good point to bring in your IT at this point, because you're going to be looking at your equipment and requirements. So you got to look to see if maybe you need to increase bandwidth. So a really good thing is to look at, one, how much bandwidth you have now, and look at really when you use the most amount of bandwidth for that, so you can figure out if you're having a video conference going on, that you have the appropriate amount of bandwidth you need and you're not going to have a distorted video for this. It's really key when you're doing telemedicine encounters to make sure it still feels like somebody is having that face-to-face conversation, so they can clearly see the person on the other side through the video. It doesn't look like the sound and the lips have, aren't matching up or anything like that. You want to be able to look and see the features of everybody clearly. Another big one is looking at your software needs as well as integration, and that comes from your EHR depending on how much integration you want with your EHR when you provide these through video conferencing. There is a big move now that a lot of companies are making sure that, one, they work with multiple EHRs and they work with multiple companies. So if you have one video conferencing platform, it works with multiple others so you can connect to more people. So the last part of your business plan is your regulatory, your management, and your financial aspect of it. So your regulatory piece is very important because that's going to be looking if you're a hospital, if there's any credentialing and privileging that needs to happen between physicians. It's also going to look at your policies and procedures to make sure that they are updated to reflect telemedicine encounters. If you're going with video conferencing or if you're going with somebody outside your organization for support, making sure you have an appropriate BAA in place. The BAA is very important when you're doing video conferencing because that's basically going to cover you for HIPAA. So for example, a lot of people I hear like to go with Skype or FaceTime for when they're doing these first encounters. It's cheap, it's easy, it's a great way to get it started. However, they claim that they're HIPAA compliant, but they don't sign a BAA. And if they don't sign a BAA, then if there is, for some reason, a breach or anything like that, it now falls on the organization alone to cover that instead of sharing the responsibility for that. Another big piece of the regulatory is reimbursement, looking at what you can get reimbursed for. Are there any restrictions out there? So as you know, New York State did pass the parity law starting January 1st. It certainly has opened up a lot more opportunities for reimbursement. And there is more legislation going on right now in New York State to expand that even further. So it's really key to look at that to make sure you can get reimbursed and make sure you're being reimbursed in the appropriate way. So your management section is something that should have already been accomplished when you're doing your needs and your readiness, and it's just reinforcing how this program is going to be fitting into the vision, mission, and goals for your organization. And that is really key for programs because if it can meld well with what you're already doing, it's going to move smoother through implementing it because it's already aligning itself with care that you're providing. The last piece for financial is going to look at both things. It's going to look at your revenue as well as your expenses. So this is where you're going to sit down and you're going to look really exactly how expensive this program is going to be for me. This is when you can start, once you have all of these processes in place, this is when you can kind of start looking at the technology. How much is that going to cost me? And don't just look at the technology. If you're going after a video conferencing platform for that, a lot of times there's yearly subscription fees. Look at staff costs with that, if you need to bring on somebody else with that, if you're going to be doing any training involved with it. As well as then the revenue is just looking at, are you doing this because you want to increase profit? Do you want to do this because you want a return on investment or you want to break even? Or are you looking at something that's more, well, I just want to increase my patient satisfaction or I want to increase my provider satisfaction because by doing this, it's making it easier for us to provide the care that they need. What level are you looking to get out of this program? So in the end, which one do you go with to create your outline? And it's really, you're just going to go with whichever one fits your organization best and whichever you're most comfortable completing. They all ultimately give you the same thing. They're building upon your needs and your readiness assessment, and they're taking you to that next step to create an outline of your program to make sure you're going to stay on track with that, creating ways to evaluate your program so you know that in the end you are providing a successful program with them. And ultimately, it's just a reference point for you. It's going to help you build into that next step. So from the first week, that master checklist that I gave out, that's from the California Telehealth Resource Center, the section that you're going to be looking at for this step is going to be defining and specifying your program model checklist. It's just a simple checklist to make sure that you have done everything you need to do with creating your outline and your templates and you've identified the next steps for you. So that is all I have for today. Thank you very much for being here, and I will take questions now if you want to put them in the questions or the chat box. So the question is, was there a template for the worksheet model? There is, which apparently I didn't attach. I just attached the one that has my written stuff examples in it already. When I send out the email with copies of our presentation, I will send out a blank template for you.
And just a reminder, if you have questions, please feel free to type in the question or chat box and send them through so that we can give you answers. We're going to give you about another 2 minutes to type any additional questions. And again, just a reminder, in the handout section, there's a copy of today's PowerPoint slides and those 2 reference sheets for you to be able to download. The presentation today was recorded and will be posted at the end of the 4-week series on our website, and you'll receive a communication once that has been posted for your future reference. And I'll give you 2 more minutes. All right, it appears we don't have any additional typed questions. Should you have questions you'd like to send privately to Caitlin, please feel free to contact her. Her email address is chuntington@ahihealth.org. We'd like to thank you for your time in this lunch break on this Wednesday afternoon, and have a great rest of your day.